While many are still weighing whether to get their first COVID-19 vaccination, millions have already lined up for a third dose.
Since the CDC recommended booster shots in September, more than 25 million people have received theirs, with more than 2 million of those given out in the tri-state area. Dana Tyler visited one New Jersey county experiencing a booster boom.
Dr. Sharif El-Nahal, president and CEO of University Hospital in Newark, knows boosters are vital.
Good evening, everyone.
The hospital is calling patients and using social media platforms like Facebook Live to answer questions about how people can best protect themselves and their families from COVID.
What is a booster? What's in it? And why is it so important?
A booster is just basically a way to train your immune system to fight the coronavirus even better. And so for Pfizer, it's basically the same shot. For Moderna, it's half the dose. And for Johnson & Johnson, it's the same dose for adults. But the idea is that your immunity does not last forever when you get vaccinated, and it certainly doesn't last forever if you get the actual infection.
67-year-old James Eubanks works as a shuttle bus driver at Newark Airport.
Now, how are your first 2 doses?
He's in constant contact with strangers and didn't hesitate to roll up his sleeve to get a Pfizer booster shot.
Well, Mr. Eubanks, feel good?
Thank you. Oh, yeah, very much so.
But is one booster enough to keep breakthrough infections at bay?
Dr. El-Nahal, will we then need another shot in 6 months?
We don't know what the ongoing frequency will be, though. So it may be the case that it's every year. It may be the case that it's every 2 years. We won't know until enough time elapses for the clinical trials to mature and for the epidemiological investigations to mature.
In Essex County, New Jersey, more than 2,800 people have died from COVID, the highest in the state. The county runs 5 vaccination sites.
We've been pushing very, very hard here. We have a call center. I've been sending mailings out. We're putting it 150% into this. It's about life and death, especially in this county, the number of people that we've lost.
At least 30,000 booster shots have already been administered in Essex County.
So I received both vaccines in this arm. Is that what we're going to do?
For people with underlying health conditions, a booster shot is critical.
So I have chronic Lyme, and I see an infectious disease doctor, and he advised me that I would be a really good candidate for a booster.
I actually looked forward to it. I was waiting for Moderna to be approved, and here we are.
I'm getting the Moderna booster, and I want to get rid of this virus or reduce it to less than a pandemic status, and want to do my part to make that happen.
With children ages 5 to 11 now eligible for COVID vaccines, will they also need additional doses?
I don't know if children will need boosters. I think it's way too early to tell.
Now, high vaccination numbers in the 5 boroughs have been touted by city officials, but a closer look reveals some areas are still lagging far behind.
In several neighborhoods, not even half of the residents are vaccinated. Aundrea Cline-Thomas looks at the efforts to combat this lingering hesitancy.
Just Been Tested, or JBT for short, brought its mobile unit to Betsy Head Park in Brooklyn.
I'll have to get a COVID test today.
To people passing by, Admin Blair and Juan Geraldo first make a pitch for COVID testing, but they hope it just opens the door for a deeper conversation.
How are you doing today, ma'am?
Good.
Good. Are you vaccinated?
JBT is one of many community organizations identified by the city to go into neighborhoods with low vaccination rates. Here in the Ocean Hill, Brownsville community, about 55% of residents are fully vaccinated, trailing behind the city average of nearly 70%.
Things that the CDC and the DOH produce and pass down are often viewed with some degree of skepticism.
Black residents are the least vaccinated at 46%. White residents follow at just 53%. Blair and Geraldo are addressing hesitancy with no judgment.
We plug ourselves in that game of telephone and provide the right information. We're trying to get number one's message back into the loop.
And city leaders say that, coupled with a television PSA campaign,
COVID-19 vaccines are here.
A $100 incentive and mandates are working.
Parents coming and seeing their kids getting vaccinated and seeing how important that is going to encourage more family members.
For now, Shakira Jones gets tested regularly, although she's been getting pressure from her family to get the shot.
Two of my friends got tested and they ended up catching COVID right after, so that made me nervous.
But conversations with Blair and Geraldo helped address some of her concerns, maybe even influence a change of heart.
Every place is requiring a vaccine card. You can't travel, you can't do anything. So it's just like, I have to do it.
While many people briskly walk by JBT's table, it's genuine conversations that could make the difference in protecting the entire community, one person at a time.
The tough road to get back to normal in the U.S.
We're going to have to figure out a way to vaccinate the unvaccinated. We're not going to boost our way out of this pandemic.
A member of the FDA's vaccine panel says 3 major things are holding us back from herd immunity. What are those 3 things, and can we overcome them?
There are too many experts, so many hands in the pot. Your head is just spinning with so much information.
Parents bogged down sorting through the facts about the vaccine and misinformation. Now they're sitting down for an open conversation with a pediatrician.